Good morning, everyone, and thank you for joining us here today to gain more knowledge about managing caregiver stress. Before we go into that topic, here's a little about who we are. Mindstory is a special needs training center that provides services such as academic support, behavior therapy, clinical psychology, counseling, occupational therapy, reading therapy, as well as physiotherapy, which covers areas such as academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Do feel free to contact us if you have any concern. Attached here will be our WhatsApp details and our contact number, as well as our email address and operating hours. Do also check us out on our Facebook page, our website, Instagram, and also LinkedIn. Okay. Now let's welcome our in-house counselor, Mr. Charlie.
Hi, good morning, everyone. Thank you for joining us this morning.
Hi, good morning, Mr.
Morning.
Charlie. Let's get into the topic of today. So before we start, can you share with us a little about what is a caregiver?
Okay, so before I start to talk about caregivers, what I want to, why we have this topic is because this year is after MCO, and during the MCO, a lot of parents are at home, especially those with children with special needs. They have to work together and take care of the child. So when you provide care for children with special needs, it's definitely going to be more tiring as compared to non-typical. I'm not saying that taking care of children in general is easy, but you need extra effort in order to provide care for those, especially those parents with children with special needs. Okay, so this is where we're going to talk about how do we manage caregivers' stress. And then a lot of parents, I mean, they have a lot of difficulty in doing what they want or feeling enjoying in terms of providing care, because it's very tiring. Even recent research shows, based on Malaysian research, you can see that a lot of parents are feeling stressed taking care of children, and then those parents with children with special needs, they experience higher stress as compared to those with typical child, or child without special needs. Okay, so back to your question, caregivers. So what is caregivers? Okay, caregivers is anyone that providing help to others that in need. So it can be professional like nurses or trained health professional, or it can be someone with no specific professional training. Okay, caregivers are known to work with people with impairments, okay, like old age, mental health disorder, disability, or disease. This is in general what caregiver is. Okay, and then the role of caregivers include assisting the daily functioning of a person. Okay, preparing meal, preparing medication. You have to bring them to visit the doctors, and also clean them if they are unable to clean themselves. Okay, or maybe they are not toilet trained. Okay, in specific for children. Okay, this way we call a hygiene management. So these are the things that caregivers will do, and normally they are providing care for someone who are unable to provide self-care or cannot care for themselves. They require someone. So this someone then provide care is what we call caregivers. Okay, so caregivers can be from either you have a specific training or health professional, or it can be someone without any background of trainings. So in general, that's what caregivers are.
I see. So today's topic is about managing caregiver stress. So can you tell us what is caregiver stress?
Okay. So before we go to the caregiver stress, okay, and then also when we talk about who are inside the caregivers, like I said, to be specific, there's two types of caregivers. One is the formal caregivers. Okay, this is the professional way you hire someone to take care of your loved one or someone who required care. Okay, this is the formal caregivers. Okay, they can be home-based, they can be a center, it can be anyone. So it can be from nurses or a trained respite care worker. Okay, these are all formal caregiver. In the second type will be informal caregiver. This can be family caregiver. They are not paid to do so. Okay, they just help out. Okay, some of the paid or informal caregiver can be the helper, house helper or maid. Okay, they don't have any specific training to provide care, or maybe you can send them for a specific training. Okay, so this is the informal where family members, they actively taking care of, children with special needs or aging family or ill partners. Okay, so these are the informal caregivers. So, and then definitely when you providing care, there's a lot of demand. Okay, so caregiver stress, that's where it characterized by emotional and physical tension because of providing care. Okay. So caregiver is likely to experience higher stress as compared to non-caregiver. Okay, so aside from attending for your child, the caregiver also required to coordinate to fulfill the others' need, like family members, your spouse, your other children. Okay, so in particular, we are talking about today is informal caregiver. Okay, informal caregiver is, like I said just now, can be family members, can be mom, can be dad. Okay, it can be parents, it can be your uncle, aunties, okay, and formal, those without any specific background training. Okay, so in general, caregivers are, experience higher stress as compared to non-caregivers. And in today in particular, we're going to talk about informal caregivers. Okay, so they are informal caregivers are those like I have a cousin or I have my niece or nephew that are special needs. I take care of them. So I'm considered as the informal caregivers. So when I providing care, I experience like higher stress as compared to non-caregivers.
But why is that?
Okay, because like I said, other than taking care of the child, you have other role or obligation. So let's say you're going back, like, okay, we take an example of parents during the MCO. Okay, you work from home. Okay, at the same time, you have to take care, you have to work, you have to take care of your household, you have to do house cleaning, you have to provide food, you have to cook, you have to clean. Okay, so there's a lot of things that you need to do at given that like you only have like 20 hours, 24 hours a day, but you can't be working the whole 24 hours. Okay, so while working, you need to take care of this. Like for example, your child started to cry, okay, and require a lot of attention. So while you're working, you need to, you have to be like, sometimes you have to be like 2 places at one time. As a caregiver, not only you have to care for the person that in need, but you also have to take care of other things, okay, your household, your work. Okay, so this is where they experience higher stress as compared to family members or couple that doesn't have children. Okay, or anyone who are not caregivers, they are not providing any care for anyone. They only have certain things to do at one time. So that's why caregivers experience higher stress as compared to those are not caregivers. Okay, so there's a few factors that contribute to caregiver stress. Okay, like you said, why is that? There's constant demand. Okay, long hours of caregiving. So for example, if your child has behavioral issue, okay, they constantly at home presenting some behavioral issue where you require to attend to them, and while you're working, okay, so you have 2 things happen at one time. So and it requires a lot of demand, and then social isolation because you are so much focused on caring for those who need, or your child, you didn't have the chance to go out and socialize. Okay, and then because of caregiving, like you focus on providing care, there's lack of self-care. Sometimes parents they have they don't have enough time to take care of themselves. Okay, or caregivers doesn't have the time to take care of themselves because very much the focus is on others. Okay, and then also one of the things is unclear boundaries between roles. Okay, so like a husband or wife or son or sibling or grandparent, there is no clear boundaries. Like wife is wife, husband is husband, son, or daughters, siblings, like that. Everyone like grouped together as one. Okay, there's no clear boundaries. Okay, and then also one of the things that it's quite common, but it's not widely discussed. It is unrealistic expectations. Okay, we can see this in a lot of, especially Asian culture. Okay, you do it all attitude. Okay, I have to, as a caregiver, I have to do everything myself. Okay, I cannot rely on this person. I cannot trust that person. I cannot work well. I cannot communicate. So I have to do everything by myself. Okay, and then sometimes I set a very high or very unrealistic expectations. Okay, so for example, this is how I clean the bowl. Okay, I wipe the bowl 3 times, and then I wash, and then I wipe, and then I expect the person that doing the same thing as me. So I set the like a very unrealistic expectation because different people have different style of care. So when I see you cannot do that, then I said, don't do it all. I will do it all. Okay, I will take care of everything because I cannot trust this, cannot do this. This is sometimes this is not very healthy. Okay, yeah. So this is one of the factors that contribute to caregiver stress.
Yeah, I think when you say like unrealistic expectations, I would say I do hear some like what you say is correct. Sometimes a lot of people want things to be a certain way. So when other people or like helpers are looking for jobs and then the parents want to look for helpers and stuff like that, their expectations are so high that they end up not being able to hire one because they don't qualify or something like that.
Yeah, not only that, when we talk about informal caregivers, yes, like sometimes also we want our spouse, okay, or our family members to do exactly like what we do. Okay, 3 o'clock sharp have to eat, 2 o'clock sharp have to do this. But it happens in formal caregivers as well. When I send my loved one or anyone that require care to that center, okay, or to that home care or respite care, short-term care, I have a very high expectation, which are very hard to work with the health professionals. Okay, so these are the attitude that we try to break because it's like the person is so focused in him or herself. That's where they limit themselves from practicing self-care. Okay, very much that it becomes what I've seen a number of times where they become helplessness. Okay, it's like don't need to talk one lah. I have no hope one lah. I have to do myself lah. Yeah. I sleep also. I cannot sleep properly because I have to think about so many things. So this kind of attitude. Okay, I'm not. This is something that we have to teach parents or caregivers in general, especially informal caregivers. Okay, on how to manage this kind of stress, because long term, this is where we talk about caregiver stress. Okay, when we talk about caregiver stress, long term of high stress, you will become burnt out. Okay, burnout is where where the person is really at the edge where they like, oh, it's so tiring that they don't feel like doing anything anymore. Yeah. So those are the few factors that contribute to caregivers in general. Okay, so in terms of Malaysian context, okay, there's a few factors that contribute other than the top, other than the few just now I shared, like a constant demand, long hours, social isolation. These are in general, but there's also in Malaysian context where I experienced. I would like to share some. Okay, one of it is lack of information. When you're providing care for someone, you don't know the condition of that person. It makes you feel like, what am I doing? You know, am I doing the right thing? Do I give enough attention? Do I give enough love? Okay, so this is where sometimes I work with parents or caregivers and talk to them. Maybe it's not the matter of how much you do. Okay, maybe it's something about what else can I do, or what are the things that I'm doing is working or not working. Okay, so this is where lack of information. We need information about this person that we are caring for in order for us to provide, not to say very accurate, but adequate enough. Because we are not trained, we are informal. So when we're providing care, especially parents with children with special needs, you are not a trained health professional, it's okay. As long as we have information about the child that you're taking care of, this is where it can reduce the knowledge gap. Once you have the knowledge, you know roughly what are the things to do, okay? Like information about your child's condition or disability, information about services needed for your child, okay? Now and in the future. So these are the information. How do I take care of my child now? And what's the next step? Or what in the future, how can I arrange help for my child? Information about how my child will grow and develop. Okay, so if my child having, like, let's say, cerebral palsy, okay, where they have limited movement, so I need to understand or at least information about how my child will grow and develop. Okay, that's where I can support. Okay, if my child gonna grow, if my child have difficulty walking, then how am I gonna support my child in walking? Okay, so these are the questions, like we rearrange the thoughts of parents, help them out, guide them. Okay, information how to handle my child. Okay, it can be behavior. My child has behavior. How can I handle them? Because there's no one size fit all technique, one size fit all treatment. You can have two children with the same special needs or disorder, but they will react differently to treatment or therapy. So that's why it's very unique. You can have most of the time you can see therapists work very closely with parents because parents know the child the most. Okay, that's where they exchange information. Okay, the knowledge gap or information gap reduce. That's where you gain information for the people that you are taking care of. Okay, another one would be social support. Okay, in Malaysia, to talk about children or in general people with disability is like a stigma. Like, yeah, why like that one? This kind of this kind of feeling when that's why parents or caregivers they tend to not to share much about their people that they take care of, especially your own child. Like, okay, for example, I bring my child out, my child has autism, okay, and then they do repetitive behavior a lot, like hand fidgeting or scratching or humming or singing in public, okay, and then people like, yeah, whose child is this? Why the child like that? So it gives us stress, like, what is going on? And then when we want to seek for help, social support, that's when we find it like, should I tell or should I not? Okay, so this is where it stopped parents from reaching out or stopped caregivers from reaching out. Okay, this is where you need to, parents have difficulty finding the right person to talk to, even family members. Okay, you can hear a lot of things about what people say. Hey, you know how to take care of your child or not?
Yeah.
Then it's like, it's not your first child, but why it seems like you cannot control your child? So this can be coming from family members, which can give stress to the caregivers. So when hearing this kind of thing, definitely it will make you upset. So when you're upset, you are less likely, or maybe you won't see that person anymore because they say something that you don't like. But then it stops you from trying to go out and find. So this is what we don't want. Social support is very important in terms of helping the caregivers to share things, share their experience so that they don't hold on to it. Okay, all the experience. Sometimes it can help others as well. Those first timers as a caregivers, you can share how you provide support and also share the burden, share the stress with people that you can talk to. Okay, if not, you can go for therapy like psychotherapy with a clinical psychologist or psychiatrist, or you can have a counseling session where you can share. Okay, but because of the stigma in the community where people question about people with disability, or they judge as they like, or they provide opinion where people don't like it. So this is where it reduces our parents or caregivers going out to seek help.
So they avoid it instead of dealing with it more.
Yeah. Would you like it when you like, Alisa, do you know how to take care of your child? No?
No, I feel like a lot of comments that are thrown at parents sometimes make them feel very fearful of dealing with it. So to avoid it, they just don't go out, which is also, I mean, because of how the mindset of other people, it affects so much. But then other people don't really see it. All they do is like, yeah,
Correct.
passing remarks, which is also sad because it makes a lot of like, parents just isolate themselves, isolate their kids.
Correct. Yeah. Because when they open up, people say things that they make them upset. So definitely they won't be opening up again. I mean, not definitely, but the chances of them to open up again will be reduced. Because I'm trying to tell you, I'm in a difficult situation. Instead of like supporting me, you ask me, you question me, or you judge me. So this is where, this is how the community is. One of the example that I always share with parents is you put two kids together, one with special needs, one without. You don't see the child commenting at each other. Yeah, why are you like that? It's all from the adult.
Yeah.
Okay, because child they follow what the adults say or they model. Okay, if a person in a community started this, it will be like, it's like a train now. Everyone will follow through. That's why when you do inclusive, or if you've been to an inclusive place where everyone is part of the community, regardless your special needs or not. When the child play together, they play together. All they do is, mommy, the person hit me. That's it. They won't say, yeah, why the person like that one? Why the person so different one? No, they don't. This is all the perception of how they learn from the adults. Okay, so this is where you can see when, as simple as going to your local playground, you can see that there's an isolation. If a child with special needs, it will be isolated by another group. But you can see who is guiding them. The adults.
Yeah.
3, 4 years old, they won't group together and attack the other or isolate another person. You don't see that. So this is the thing when parents also get upset. I try to bring my child to go and expose, but yet because of people around me. But one of the reasons why they do that is also lack of information. I don't know what is happening to that child, but I distance myself. It's okay because I don't have the information. But if information is widely shared, everyone know this condition, then it will become, it is part of the community. It's just that how else can we help instead of like questioning the parents.
Yeah. I think I really agree with the part where you said that it's actually someone guiding the children to act this way, because the other day I actually did see a video of an inclusive setting where there was two boys, one on a wheelchair, and they have to run to the other end. So what they did was this boy, he ran to the other end and he ran back. And then the next round, he actually pushed his friend on the wheelchair. And it was like an inclusive setting where they were including the child in that activity, which is very nice to see because, like you said, a lot of times children don't really get to experience this kind of things or to even lend a helping hand to their friend that is in need because of what they are told or what they think is right to avoid. So
yeah. If you see in like I've seen, like if you've seen in like elderly care, okay, old folks home, when all the elderly people gather together, they also enjoy their time. They don't say like, yeah, why you on wheelchair one? I have this condition, they don't do that. So this is where, you know, when you have difficulties, we tend to like help each other. Okay, this is where this is part of the reason why we are here in Mind Story. Also, we share a lot of this information to parents, even to the public awareness. Okay, because in Malaysia, informal caregivers is the numbers higher than in formal. A lot of family members now taking up their time in providing care. In fact, the numbers is higher than formal, or than those trained. Okay, so this is the reason why we are talking about this. We want to share the knowledge or information to help as many, and also give the public an awareness. You know, people that providing care for children with special needs, in particular, like here in Mind Story, where you know, give some. If we cannot help them, but at least we like, okay, wow, you did a good job, like, you know, parents, wow, and then just in terms of like providing like care, yeah, support, okay. And then another factors is financial aid. Things can be expensive. This is additional stress to the caregivers. Okay, you have to pay for the food. You have to pay for special milk formula. You have to pay for hospital expenses. You have to buy supporting aid. You have to pay for medical fees, therapies, daycare, and other services. Okay, so this is where it add on to the burden. Okay, you already have a stress. You already are taking a lot of time taking care of your loved one, and then now you have to work, generate income to pay or additional things. Okay, and then another one is community support. Okay, doctor services, as simple as dentist, GP. Sometimes you just call them up. Hi, I have a child with ADHD. Can I go? They said no. Okay, and then education, preschool, social activities, all this. Okay, social activities, like I said, as simple as going to your local playground. Sometimes it can be hard for parents because of the stigma they face. Like you know, I don't want to play with you. My child cannot play with your child because later he will learn all the bad things. Okay, there's no bad thing. That's the characteristic of special needs. It's not bad. Okay, there's no bad or right because it's born. They are like that. Okay, there's no bad or not bad. Okay, and then education. This is also another big thing in Malaysia. If your child has special needs, it's really hard to go to school. Okay, this is where it comes to blaming. Oh, the school don't want me because of this, and you know, this and that. But actually, the school cannot accommodate. Okay, maybe they don't have the teachers, or they don't have the facility to support. So this is where we have to find places of education that can help us. Okay, this is community support. Okay, and then the last one is this one play a big role because in Asian country is in our culture. We are collectivists. We are a group. We are like we tend to stay in a group instead of individualism like the Western country. Okay, so this is where family support is very important. Okay, you have your spouse. Okay, single parents, they need the family or siblings to support them. Okay, if you have a family of your own, then you have your spouse to support you. Okay, support each other during difficult time. Taking care of someone can be is difficult. Okay, regardless the child has special needs or not, basically taking care of someone is not going to be easy. Okay, this is where you require support from each other and then discuss problems, okay, and look for solution, not blaming. Because of you lah, I got child like this. Because and so lah, okay, my child is like that because of here, because of that. No, we can talk about, you know, blaming for years and years, but what's the point of, you know, blaming? Okay, we are here to discuss about what we are facing and how can we move forward. Okay, what is stopping us from going forward? This is why family support is very important. And then deciding on family roles or tasks. Okay, let's say today I have a meeting. I discussed with my wife before that. Tomorrow, 2 o'clock, I got meeting. Our child has a appointment with a doctor. Can you bring it? Okay, if she said she cannot, then I asked my sister or my other, can you help me? So this is where you decide family roles and tasks. Okay, just help me bring that because I have a meeting. Can you please do that? And this is where it's very important.
Yeah. So I think when you say family support is very important, also like communicating with each other.
Yes.
When you lack of communication, it's like one person know one thing, the other person don't, and then
Yeah.
so messy and it will get very stressful. So I would
Yeah.
say.
Yeah, it's natural for people or human in general to have preempt thoughts. Like I know him one he won't do one So
Yeah.
then it's stopping you from asking. Sometimes there's no harm in us. Worst come to worst, they say no.
Yeah.
So
But at
it's
least you ask.
no correct. There's no harm in asking, just ask and then whether yes or no. Because if you preempt that or you have reservation about the person rejecting, then it will reduce your chances to ask a question again. So this is something that we need. It takes time to practice. Yeah, it's normal because everyone have that pre-thought. The moment they see you, like, oh, this person can be like this and so and so. Okay, but it's no harm in asking. So if one thing that I learned is if you never ask, the answer is always going to be no.
Yeah.
Okay. So if you ask, the probability is 50-50. 50% yes, 50% no. Okay. The chances, you have 50% chances of yes as compared to when you don't ask. When you don't ask, forever the answer is going to be no.
So when we talk about all of this, right? Is there any signs of caregiver stress?
Okay. That's a very good question. The common sign can be you feeling worried most of the time. Okay. Overwhelmed as in like you cannot you cannot somewhat work on other things. Like you feel like, wow, I'm tired. Everything I do, everything I in my head is all about providing care. Okay, and then when you're away from the person that you care for, you feel worried. Did he eat on time or did she eat on time? Did she go to the toilet? Yeah. So this is constant worry. Okay, and then often feeling tired, fatigue, even after you have enough sleep. Let's say you have average of 8 hours of sleep. When you wake up, you feel like, it's like, sometimes, people say Monday's blue when you wake up, I have to go to work. But this is constantly happening. It can be on a daily basis. Like the moment you wake up, like, I have to take care of a person. This often feeling tired even after good sleep, angry, frustrated very easily. Okay. Sometimes in general, people tends to put gender in. Okay, but regardless gender, gender do contribute. But if you are experiencing caregiver stress, you can see one of the signs is getting angry easily or frustrated and easily. Say maybe some little thing can trigger them. Okay, it's not only about gender, but in general, female or male, if you experience caregiver stress, you can experience this as well. Okay, another one is physical. You can see that person gaining or losing weight. Okay, other than feeling worried, you also feel sad most of the time. It's like, why is one of the things that I learned from caregivers, informal caregivers, is they feel sad like, why is my life like this? Is this my destiny? Sometimes they may include religion. Is this what my God of your understanding want me to do? Okay, why? So and then they feel sad, like I cannot do my things. People my age get to go out. So these are the statements that I hear from
Start comparing.
yes, correct. And then they feel sad. It's really quite sad story. But this is one of the signs. Okay, and losing interest in activities like they used to enjoy certain hobby, but now they just lost it. They just have no interest at all really, and they are no longer enjoy the activity they like. For example, like cycling. I used to like cycling, but now not anymore. So this is where or one of the sign. And then you have frequent body aches, headaches, a lot like because of caregiving. Okay, difficulty in sleeping or insomnia. it takes longer time for you to fall asleep. And then one of the things that not all, but this is where increased usage of substance. Okay, they use that to cope with the stress. Okay, for example, drinking, smoking, taking prescription medicine, or illegal substance like drugs. Okay, so they use that to some of them use the word rejuvenate, which I find it very funny because you don't use illegal stuff to regenerate. So, I mean, this is the source that they go to, okay? Because I do this, it doesn't take away my stress. Okay, I do this, I cannot. So, I need something to suppress my stress. So some of them, they go to the extent of drinking excessively. I'm not saying that caregivers cannot drink, but some of them, they take a step ahead where they drink more than they should have, and then they smoke more than they should have, okay? Or someone who never smoked but pick up smoking. Okay, this is one of the reasons. I'm not saying that, you know, when someone take up smoking, they are caregivers. It's not like that. But in the caregiving situation where they never smoke but they take up, it can be that. Okay, and then drugs, prescription medicine, okay, or illegal drugs. Okay, they take. This is their way of how to suppress or bring down the level of stress, which is not very healthy.
But when you say like drinking and all of that when we start, right? Is it something that is in the mind? I'm
Okay.
wondering.
How alcohol and drug works or medication, they have this what we call inhibiting effect. It can inhibit, it can suppress certain emotion. Okay, some of them, not all, when they drink, they feel happy, they feel lightheaded, you know, they like that feeling. So this is why this is one of the reasons why they drink. But if you put in terms of caregiving, you know, after providing care, you're so tired but you cannot sleep, so you drink yourself to sleep, because the more you drink, the more it gives the disinhibiting effect. It stops you from feeling certain way, or maybe it makes you feel good, and then of course it makes you drown. Okay, they have this contained in alcohol that makes you drowsy, and then eventually you fall asleep.
But there's also like people that drink, right, or they get high and stuff like that, but then they end up feeling more of what they are going through.
Yeah, definitely.
Worse.
Some of them, that's right. The first drink, maybe they feel, this is what we call dysphoric effect. Okay, when you drink, you feel sad. So you drink more until you don't feel sad. So this is one of the concepts. Yes, it happened. Okay, it's something that you don't see quite often, but it happens. Okay, I can tell you in Malaysia itself, the numbers are rising in terms of providing care because of stress, because of caregiver stress. People are using other alternative to reduce this stress. This is where it become unhealthy coping behaviors. Okay, so that's why you turn to something that give you immediate result. Okay, let's say for example, I have caregivers or parents that come to me. Counseling so long, talk so many sessions. Okay, you talk, then I have to do practice, I have to do homework, so many things. But when I turn to drugs, it's like, oh, I have headache, I pop Panadol, okay, done, no more headache. It's the same thing with prescription medication or unprescribed or illegal drugs.
So it's more immediate if compared to seeking help.
Correct. Yeah, nowadays it's about convenient, how fast, how effective, but it doesn't apply to everything. Okay, I want it here and now. I want immediate effect. So the fastest way is this way. But that doesn't. It's like, you know, when you're young, our parents or anyone said you have to eat veggie to stay healthy. But it's a long-term thing. It's not like I eat veggie today, tomorrow I will be healthy. No, you have to have this practice lifestyle. So this is what managing caregiver stress about. Okay, you have to have a lifestyle, a way of coping. Okay, but because like I told you, the factors, some of them stopping them from going out. Yeah, so it's a lot. It's like a spider web. Everything like connected to everything, And then it's about how some of them, they use this method as a way of coping with their stress.
Mhm. So when it comes to being stressed as a caregiver, are there any effects of caregiver stress?
Definitely. Definitely. Stress is not built up 1 or 2 days. Okay, it's a long term. You can initially say, some people I've seen, they say, I can handle, but in long term, this is where we call burnout. After stress, it gives you burnout. Okay, long term of stress of any kind, not only caregiver, but under long term of stress, definitely it will take a toll on your mental and physical health. Okay, there's only so much your brain or your body can take under stress. Okay, increase of mental health, like depression or anxiety or burnout. Okay, and this for mental health, and also it will increase the risk of other health issues, such as those caregivers have existing heart or high blood pressure or diabetes. It will worsen the situation. Okay, they will increase the risk of that. Yeah. And then also, one thing that we don't talk very much is the quality of life. Okay, reduce in appetite, lack of sleep, unable to enjoy free time. There's no, I'm busy, I cannot make it. I have to take care of this, I have to take care of that, I cannot go out. So yeah, this is the quality of life. And another one that we hardly talk about is the family relationship, as well as for married couple, okay, the marital relationship. Okay, marital satisfaction is lower. Okay, so it will impact on it, like constant stress on both spouses. So you have to work things out, and also family. So quality of life is the big thing. Under quality of life, you have others like for marital relationship, family relationship. All these are very important, because taking care of someone for long term, okay, when you're under stress, these are the things that you have to work with. Okay, reduce in spending time with your spouse. Okay, you no longer enjoy doing things with your spouse. Okay, this is for marital satisfaction. Again, it's for family members. Maybe you become estranged. Why? Because my brother say me thing about my child. I asked him to send for a doctor appointment only. He did nagging me, say I don't know how to take care. So I become estranged with my brother. Okay, so you can see how one stress impact on quality of life, and it translates to all aspect, okay, of life. And also, I would like to share a video. See this video? It's like it become a headline. Okay. Let me find the video. Okay. Can see this video is just purely for information. I'm not trying to scaring anyone that joined us today. Can you see it, Alisa?
Yes.
Okay. All right. So this is just this is like the next extent of what caregiver stress can do or burnout.
88-year-old Martin Turkovich is free on bail after being arraigned earlier this week on attempted murder and assault charges. Cheektowaga police say he went after his 86-year-old wife, Rita, with a hammer on Saturday night at Garden Gate Healthcare Facility on Union Road. She was seriously hurt and is still being treated at ECMC. The defense says Rita has dementia and that Martin has been caring for her for the past 7 years. Well, are you caring for someone with any kind of disease? Well, if you are, you know it can be challenging, both physically and mentally. So how can you cope? Tonight, 7 Eyewitness News reporter Ed Riley walks us through one woman's journey and how she is conquering caregiver stress.
So the emotional toll is difficult. for as far as caregiving.
Lisa Rigi is a member of the sandwich generation. Not only is she a wife and mother caring for children who have health problems like diabetes and fibromyalgia, Lisa is also a caregiver to her own 87-year-old mother, Helen Tice.
And just to see your family member, in my case, my parent, decline in health, I mean, we know the ultimate journey.
Caregiver stress is a part of Lisa's everyday life as she is constantly in motion, dressing her mother, checking blood, fixing meals, making appointments, and cleaning the house. Lisa also runs a home business that helps other caregivers find help because too often caregivers try to go it alone.
You can't ask for help because you don't want to burden anybody else.
But caregiver stress and burnout is serious, and you need to watch for signs.
You just want to get out of the situation, or you want the situation to end because your pain has become so much.
There are many resources to help caregivers, so who should you call first?
First step I always recommend is the Office of the Aging.
For Helen's mother, her daughter's efforts are greatly appreciated. And before she needed care, Helen was herself a longtime caregiver for her husband and other relatives.
You just get tired out.
Helen's advice to other caregivers?
They've got to ask for help.
For this North Tonawanda mother and daughter, it is now a journey filled with ups and downs.
We have our laughs and we have our cries.
But a journey that both are taking together.
I love you, sweetheart.
You too.
And the challenges of being a caregiver take on a whole new level of difficulty when you're dealing with someone who has Alzheimer's. Coming up at 6 o'clock, some advice for people in those situations. In Williamsville, Ed Riley, 7 Eyewitness News.
Thank you.
So yeah, this is one of the example. Okay, so you can hear from the caregivers. Okay, this is informal caregivers. Okay, this is what we're talking about. Like they are not specifically trained to providing care, but they are family members. Okay, hey, you heard the term sandwich generation? Okay, so this is where they use the term to talk about providing. They are sandwiched in between providing care for others as well as taking care of themselves and other family members. So this is what they call a sandwich. Okay, you have to work around so many things, and then at the same time providing care for that person. Okay, so this is where it's not an easy task. Okay, so basically you can hear that they say that you have to reach out. So one of the reasons is that taking care of someone can be very demanding, can be very tiring. Okay, and also if possible, talk to someone and reach out. Okay, it's a very important step or very important move, especially for caregivers. Okay, it can help you to reduce. Okay, because some of them, like the video, they said they just feel like they just feel like sometimes it's better to end the situation. Okay, I have met people who say that as well. That something like, I shouldn't have. This is for children with special needs. Yeah, I'm just sharing this, not to say I want to scare people. They say that sometimes I just wish I don't give birth to this child. Okay, this is where some of the signs really it can be quite. They are already under stress. Okay, when you're under stress, you tend to say something that maybe you didn't mean to. Okay, so these are the things that I don't. Why me? Okay, I wish I don't have such a child, or I don't have to take care. You just want that thing to end. Yeah.
So with all of that, right? Earlier you actually did mention about self-care. One part of it is self-care. So can you share with us a little about self-care?
Yeah. One way, like the title, managing caregiver stress. One way to help you to elevate, to help you reduce your caregiver stress is self-care. Self-care is something that is very, very important. Okay, this is what I always tell parents or caregivers or informal caregivers, family members. Before you take care of someone else, please do take care of yourself first. It's very, very important. Okay, this is what we all heard before. When you know how to take care of yourself, you know how to take care of somebody else. Okay, So it's very important to take care of yourself. You have to be healthy in order to, you have to be taken care of before you take care of someone else. So this is where the word self-care. Okay, and there's some strategies in terms of doing self-care. Okay, self-care is one of the most important components in caregiving, but it's often forgotten. Okay, some of the time, like I ask like, when's the last time you have a me time, taking a break, doing something that you like? It's almost zero. This is the response that I get. Maybe in 10%, I only get 1 or 2. It's like a 5-minute break. I can't even go to the toilet, I have to take care, this, but it's okay to take a short time off, okay, just for yourself, okay? And then caregivers can experience emotional roller coaster, okay, if you don't practice self-care, because self-care help you to give yourself some time and take care of yourself. Emotional roller coaster. So once you feel rewarded by taking care, it's like, wow, you see, maybe the person improved or well taken care of, you feel impressed. But the next minute, I'm so tired, why, I'm worried, anxious about caregiving, why is this happening to me? So you can see from one side to the other side, is, we can, the roller coaster, the emotional roller coaster going up and down. Okay, why self-care? Okay, only when you first help yourself, then you can effectively help others. Okay, when your needs are taken care of, the person you care for will benefit too. Okay, there's only, like people said, you have to stay motivated. But how? How long can you stay motivated when you're tired?
Yeah.
Okay, it's easy to say than done. So a lot of people like, you can, can one lah, you have to stay motivated only. Yeah, but how? Okay, I can say how much I want, but because I'm not the one that providing care. So this is where when a person themselves get taken care of, if the motivation can stay longer, okay, they feel motivated because they are taken care of. So the person that they take care also will be benefit too. Okay, and another thing that I always let the caregivers or anyone know that you have no control over the impact of the diseases or the disorder. You cannot control the impact of that disability. Okay, but you have a full control of your well-being and your own needs. So control the things that you can, but don't control the things that you cannot.
Yeah.
Okay. It's like the weather. It's rainy, it's sunny. You cannot control the weather, but you can control the activity you do during sunny day. Okay, it's not like I want to go swimming, raining, then cannot like that. You can change the things that you can, but some of the things you cannot. It's like the weather. So take full control of what you can do. Okay, especially when you're taking care of your child. If your child with disability does not progress or in a way that become worse, okay, don't blame yourself for it. Okay, because we cannot control the disease or the disability. Okay, yes, we can provide support, but sometimes support is not 100%. Okay, sometimes they can just degenerate all of a sudden out of nowhere because of certain medical help. But don't blame yourself for not providing enough care. Okay, this is the nature of the disability. Okay, but you can control about yourself and how you manage that situation.
I think, like you said, caregivers, I think what they like also would be, like you said, taking care of themselves, because that also makes them feel very much more like they want to do it, but they are so tired and they don't know why they are tired also. It's like sometimes that feeling of wanting to do something and then you're already so stressed, but then you feel bad for feeling stressed.
Correct. Yes.
Bad for feeling the way you feel, but so you hide it and you bottle it up.
Correct.
So all the emotions are so like scary. It's like, how much can you bottle up? You're going to explode one day also.
Yeah, correct. This is the thing that I believe a lot of people will hear. Try holding a cup and start pouring water. How long can you hold that glass of water on your hand without putting it down? Okay, and definitely the water will overflow, but you get tired also. So that's the analogy or metaphor they use. Okay, and yes, correct. Some of them, they feel guilty for not taking care of the child. Some of them feel guilty for taking a short break for themselves. Okay, they will be like, I cannot be so selfish. I need to sacrifice myself for the person that I take care of. No, you can take care. You can take a break and take care of the person also. Okay, take turns. Okay, when you feel really tired, when you're not focused, things happen. Then what? You blame yourself because you're not taking care. Good enough? No, because you are tired.
Yeah.
So
I
you
think that's
cannot.
why-
Yeah, you cannot stay focused and give full attention when you're tired.
So that's when you said the family support one comes into place also, taking turns, communication and all of that.
Right. It is very important. Okay. And then another one is identifying your personal barriers. Okay, like the video we seen, belief and attitude versus self-care. Okay, it's a lifelong pattern, non-stop. What you believe and your attitude versus self-care is a lifelong. Take care of others might be as easy as other than taking care of oneself. Okay,
Yeah.
actually, it's the other way around. Taking care of yourself is much easier than taking care of others, because these are the small things that we tend to put it to sleep, like put it aside, sleep it out of your mind. Okay, it's something that we are not practice in doing it, but self-care is very important. So this is where you have to identify your personal barriers. One of it you shared just now, you feel guilty. Some of them are here. I cannot be so selfish. I have to take care of them. If I don't take care of them, who will take care of them? So yeah, break the pattern. This is the pattern that we want to break. Okay, it's not an easy proposition. It's really propositions like who will take up the caregiving role. Okay,
Yeah.
if I'm not feeling well, if I'm not longer around, these are the things that I often listen. When my child grew up, I'm no longer here. Who's gonna take care? If I'm not feeling well, that's why when some of the things that you have to take care of yourself. For example, if I'm not feeling well, that's why you have to take care of yourself.
Yes.
Okay, and I'm no longer around. So this is where we have to work as a family. If you with a family, then how we're gonna plan it out? You keep thinking about what's gonna happen, but what is the solution? It's
Yeah.
no wrong in thinking, but we have to identify. What's stopping you from achieving that goal? We have to break this pattern. Okay, yes, a lot of things like worried you, but you have to take a time of let yourself rest. Okay, when you're well rested, then you can continue providing care. Okay, and then how do you remove personal barriers? You have to identify your own way. Okay, so it's like, is it frightening to think about your own needs? What is to fear about? Do I have difficulty asking for help? Do I have trouble asking for what I need? Do you feel bothered or inadequate if you seek help? Why so? So these are a way of, you can ask yourself, okay, what is stopping me from providing self-care? Or what is stopping me from having a break for myself? Okay, am I selfish if my priority is about my needs? Okay, am I worthy? Do I need to prove myself? These are the things that I hear from caregivers or parents. Okay, so this is where you have to find your own way. Okay, what a mental health professional can do is they guide you to identify such barriers, and you have to work together with mental health. Once you identify your personal barriers, what is stopping you from doing self-care, then we have to look toward how to achieve it. Okay, and then there's a misunderstanding that increase stress and anxiety. This is very famous. Negative self-talk a lot. Okay, if I don't do it, no one will. Okay, no one can take care of one. I tell you, these are the things I often hear. My wife cannot one. She's not patient. Or my husband cannot one. Sit a while and then he will start playing the phone. These are the things that I hear quite often. No one cares as much as I do. sometimes I ask them, do you ask people around you? No. So when you don't ask, then this is where you have it. No one cares as much as I do. Okay, I am better. No one is better than me. I am better. That's why I take care of them. Okay, it is my responsibility to take care of my parents. It's my obligation. Yes, but that doesn't mean you cannot take a break for yourself. You mean, like, for example, you go to work, you have obligation. Okay, then why, when you take sick leave, do you go back to office? No, you stay at home. It's the same thing. Okay, when you're tired, when you don't feel like going to office, you can just take a break. The same thing, you still have obligation to work. You still have, it's your responsibility to go and work. But then if you're tired, you can take a break. Same goes to caregiving. Okay, and some of them are not all. It's like, am I worthy? So they will prove it. If I do it right, I'll get the love, respect, and attention that I deserve. So these are the some of the negative self-talk. It's not easy, but what I normally share, one of the steps is to challenge such self-talk. Okay, provide evidence base. Okay, for example, if I don't do it, no one will. Then, in order to challenge this thought, we can start asking people around us. Okay, if I'm tired, can you do it? He said no. Then you ask others. Okay, so this is where we can identify how we challenge negative self-talk. If you sit there and have this constant negative self-talk, eventually you will feel stressed also because of this negative self-talk, and it's just stopping you from getting self-care even more. Okay, you just stay there and you don't want to move anymore.
Yeah.
Okay, or it can be like, I can never do it the right way. I have to find the right way. I didn't give enough love. I didn't give enough of this care, attention. Okay, I can't sleep well and I don't have time to do things I like. Yeah, these are the statements that I hear quite often. Okay, so when thoughts, belief, and attitudes, these three things, they will projected into behavior. Okay, so how you behave is closely related to your thoughts, your belief, and your attitude. Okay, for example, your thoughts. No one is better than me. Okay, and then your belief is also, I am better. Okay, your attitude is like, people around me cannot harap one lah. Then what's your behavior like? You will not go out and seek help. So this is how it closely related. So over the times, you can see these three things become very complicated. One is become very complicated. It's not easy to untangle all this. You have to untangle all these negative thoughts. You have to change your thoughts, belief, attitudes. Okay, sometimes people say change is not as easy as that. Okay, sometimes you require, if you see in a clinical psychologist, a counselor, or psychiatrist, some of the things they do is to challenge this attitude, belief, and thoughts, and give, there's a model ABC, your affective behavior, and I forgot what it said, ABC. And then also this we can hear a lot in people who practice cognitive behavior therapy, CBT. They will challenge your negative thoughts. Okay, they will do a lot of practice because, yeah, it's normal. Everyone have this negative thought, but it's just that to what extent are you going to dwell in it? Okay, how long are you going to dwell, or how you layan these thoughts now? That's what people always say. How do you layan the thoughts? Yeah, how far are you willing to go? Or are you going to challenge it? Okay, and then misunderstanding leads to one to attempt to control things that cannot be controlled and do what cannot be done. Okay, yeah, this is a lot. It's funny, humans like to control things that they cannot control. It's really funny. So, for example, like I said just now, disease, we cannot control disease, but people tend to self-blame or blame others because of the certain situation that getting worse. Okay, frustration due to continued failure are likely to engage in self-care. Okay, and it's really important to identify your personal barriers. Okay, what is stopping you from achieving it, and then we have to start action plan towards self-care. What is stopping you from doing self-care? Yes, a lot of things, negative thoughts and whatnot. So different person have different way of doing it. Okay, then this is where we have to start planning. How do we do it? One of the ways, like I said, challenge the thoughts. That's only for negative thoughts. Okay, there are other things that you can do it. The unhealthy way is like I explained just now. Excessive alcohol use, excessive smoking, taking drugs, taking prescription. Okay, sometimes taking prescription is not that it's bad. It's in a situation where you require medical attention. Okay, psychiatrists won't simply give you something and then you don't prescribe you some medication just and then you can sleep with it. No,
Yeah.
there must be a psychological presented issues before they give you some medication. But if you take it without the recommendation or prescription from doctors, even though it's prescribed or you're taking higher doses by yourself, that is not right.
Mhm. So we spoke about so many different things, but like in managing stress itself, like what are the type of strategies that you can use to handle
Right.
caregiver stress?
Yeah, so just now we talked about self-care, we talked about personal barriers, because this is the things that I experienced while I'm working with parents and also caregivers, informal caregivers. Okay, these are the common things, personal barriers to self-care. So when it comes to strategy, we have to reduce your personal stress. Okay, the perception is stress not only from caregiving, but also a result of how you perceive caregiving.
Mm-hmm.
Okay, how you see things. People talk about the glass is half empty or glass is half full. So it really depends. Again, if when you see, or for example, I don't like my younger sister. She always annoys me. And then until now, I still don't like her. But one day she's not feeling well. I have to take care of her. So you see, my perception of her is already, wow, this is my annoying sister. So when I provide care, I get stressed, not because of caregiving, because of her. So this is also considered, this is contribute to the caregiving stress because of your personal stress. I personally don't like this annoying sister. Then now I have to take care of her. So it's like, what is going on? Like, so caregiver stress, one of it is your personal stress also can contribute. It depends on how you see the person that you're providing care. If I don't like this person, and then you ask me to take care some more, wow. It definitely gonna increase my stress. Also, another thing is voluntarily or involuntarily. So my situation just now, I don't like my sister, she's annoying. Okay. And then now my parents asked me to take care of her. I was like forced. So I did not do this voluntarily. So it changes my perception. Okay, I really don't like my sister. Now my parents forced me to do it. So of course, when I do things will be half-hearted. Okay, because I don't like, I was forced to do it.
Mm-hmm.
And how I see this also will change, because it's like, what on earth is going on? I don't like her now. I was forced to doing this. You know, it's not fair. Yeah. So this is involuntarily. Okay. And then voluntarily is volunteer. Someone volunteer, but it's like not really volunteer. It's like, if I don't do it, no one will do it. You know, so it's like, I feel like there's no choice. Okay, experiencing negative like resentment, tightness, strain, like I shared about my sister just now. Okay, and also it can relationship between caregiver and the person that receiving care can contribute to personal stress. You have to develop a healing relationship, more likely to experience regret and discouragement when hope is not met. Okay, when you're taking care of someone, especially those who can talk. If children with special need or disability, sometimes if they're able to talk, they can ask things that, you know, on a daily basis, they can ask you something that it can be sometimes hurtful. Mommy, why I'm like this? Mommy, why I'm so different from my friend? Imagine you hear this on a daily basis. So it's not easy.
Yeah.
Say, Mommy, why I born without leg? Mommy, why the child can run? Mommy, some of them when they born with weak immune system, okay, they cannot go out mingle because any kind of like flu or fever they can get in a bad situation. So imagine they ask you this question. It's not going to be easy. Okay, and then coping skills. Your coping skills have to be enough to support your personal stress. Stress is always will be there. Okay, it will when we feel we cannot manage the stress. This is where it's getting higher, and our coping skill cannot match. Okay, stress will always be there, but we have to keep it at the bite size. We have to keep it at the managing level. So our coping skills have to go hand in hand. Okay, the moment you feel like I cannot do this anymore, this is where you know your stress is high, but your coping skill is not as high as your stress. Okay. Also, it depends on your past, how in the past how you cope with stress. It can slightly predict how you can cope with your stress now. Okay. One of the things is to focus on the strength. Okay. Focus on what you do good, how your strength, and then focus on developing your strength in terms of coping. Okay. And then the settings. Some situation can be more stressful than others. Like the condition of the disability. For example, my child has cerebral palsy. It's harder to take care as compared to autism. Okay, some situation is definitely harder than the other. Okay, and then one of the thing is like bedridden child. You know, they have to stay on the bed. They cannot walk. You know, they are weak. Definitely, it's going to be harder as compared to others. Okay, so these are the things that can contribute. Okay, and then those are the things we talk about how we can contribute to personal stress. So now, how do we reduce your stress? Okay, one thing, first is to detect early signs. Like I said just now, when you feel like you are tired, we have to, this is where you know that your coping skills are not on par as stress. When it's on par, your stress will be under control. Okay, you can manage. Okay, how do you know that? Is, you know, when you like, tomorrow got exam, but because you're well prepared for exam, you feel less nervous, less worried, hence less stress. See, you can see how you can match it up, your coping skill and your stress. So in terms of coping, one way is to reduce the stress. How? Is to detect early signs. Okay, one of the signs is irritability and difficulty in sleeping. Okay, like it takes longer than usual to sleep. You become irritated very easily. Okay, know your warning sign and then make these changes. If you cannot sleep or you feel irritable, then start making changes. You don't drag on this issue. Okay, identify the source of stress. Okay, this is sometimes I told parents to surf. When you have this, surfing is not easy. You know, when you're on the sea, okay, you stand there and face the wave. Eventually, they'll knock you down. But if you surf with the wave, goes up and down, you're able to maintain on top of the water instead of knocked down by the wave. Okay, surfing is not easy, but you can do it by what do you call this? Like sit with that emotion and start thinking, why is this happening? Okay, it takes practice. Okay, it increases your awareness as well. That's where you can identify your issue. Like, I feel sad and then I start shouting at everyone. Then you can, when you serve your emotion, it can bring back to, sometimes can, but sometimes cannot. Okay, it's not 1 day or 2 days, but it takes time. But it can help you in identifying what is the source. Okay, like parents work at home, working from home, they feel stressed because the boss scolded them. You know, suddenly the child make noise next to it, and then I'll shout. But the source of the anger or upset is from the other side, but we put it on others. Okay, so this one is we have to identify the stress and how we can reduce from it. It can be family disagreement, you feel deserted, you got scolded. Okay, and then like I said, control. Control is very, very important. If you cannot control something, it makes you feel like, wow, something is wrong. I cannot. Okay, so I have to take control of everything. So when you can take control, you feel good. When you cannot, you feel bad. Okay, but you have to know what you can control and what you cannot. Okay, if you try to control things that you have no control over, definitely you feel feel bad. You have this negative feeling. So what can I change? What do I have some control over? Okay, for example, working, like just now the situation, I'm working here, my boss scolded me, then my child making noise next to me. Instead of shouting and I feel upset really, what are the things that I can control?
Yourself.
Correct. I remove myself. I tell my boss, I'm so sorry, boss. Maybe I make an excuses, tummy ache. Okay, I see you later. Then I go toilet, then I sit myself there. I was like, wow, I'm so angry. Because the child make noise, my boss is scolding me. How can I control this whole situation? Some of them say you can. Yes, that is controlling the setting, but do you really able to control the settings? Shouting at the kids doesn't mean you're controlling the situation. Okay, sitting there facing your boss doesn't mean you can control the situation. Your boss is angry, your boss is angry. You cannot change the angry to happy. That's his, that's my boss feeling. I cannot like boss happy lah, boss happy. Okay, you can try, maybe it works. Like, when your boss scolding, you crack a joke, you see what happened. Maybe it works, maybe it don't. But some of them, I can control the situation, but that is not control. You cannot control how people feel about you. My boss is angry, they scold me, I stand there and let him scold doesn't mean that you are in control of the situation. It meant that you can take the scolding very well. So it's a very different. You can handle the scolding and you can control the situation. It's very different. Okay. So like I said, what you can control is yourself. Okay, yes. One side is noisy, my child is making noise here, my boss is calling me. So what I can control is my action. What I can do, I can control my emotion. Okay. Yeah. So like when your boss calling you, you feel upset, but you don't show it your face. That is controlling your emotion, not to lash out. Okay. So that's why you have to we have to differentiate what we can and what we cannot. Okay. Like I said just now, I can remove myself, go to the toilet. Okay. Maybe I cry myself out because it's so upset. Yeah, I did do something, but my boss don't want to hear me. Then I try to work. Then my child making noise, or showing some behavior. So once I vent out, I cry myself out, or I vent out my emotion, it reduce. Then I go out and face the situation again. Okay. So action plan. You have to control by acknowledging the stress. Okay, improving your coping method. What works in the past, and then you apply now what didn't work. Okay, and then work on stress reducers. There's a lot of stress reducers available. Exercise, gardening, meditation. Like I just now tell you, I make an excuse to tell my boss I got tummy ache, I go toilet. Okay, it's one way. Whichever you feel. Okay, as long as you need that time when you know that you cannot handle, take a break from that time. Don't extend. Okay, like I said just now, I cannot tahan really. My boss keeps scolding at me, and then my child is making noise. So for me, okay, I can control myself, but I have to remove myself from this situation at this moment. Okay, so you have to find some of the way, because different people work differently. Stress reducer can be exercise, gardening, meditation, go for a short walk, taking a short break, do the things that you like. Okay. Another strategy that's we talked about reducing stress, personal stress, because your personal stress can contribute to the caregiver stress, because your role is not only providing care, but you have other work as well. So you have personal stress, and then when you have to take care, that stress plus taking care stress all together, it will just multiply very fast. Okay, and another one is those who work required to fill up the KPI or performance. Okay, this is what we talk about next. One of the strategies, setting goals. Okay, decide what we would like to achieve in 3 months or 6 months. Okay, goals are very sometimes can be too big to achieve at once. So you break it into a smaller goal. There's something what we call smaller goals. SMART goals. Can specific, measurable, achievable, and realistic and timely. SMART. Okay,
Mhm.
so specific, measurable, achievable, realistic, and timely, SMART. Okay, there's 5 words. Okay, so when we talk about specific, what do I want to accomplish? It has to be specific. Okay, for example, I want to reduce my stress by doing meditation on a daily basis, 15 minutes a day. We set goals. Now our goals we set to self-care. Yeah? Okay, this is an example. This is what I want to do, self-care. So I want to reduce my stress by doing medication, 15 minutes a day. So I said that this is what I want to do in the next 3 months to 6 months. How do I accomplish this? How is it measurable? I record how I feel after, before and after meditate. Okay, and then I record how often I meditate. If I meditate today, if I meditate 5 days a week, how is my condition? Is it better than when I, as compared to when I meditate 3 times a day? And then achievable. Okay, how do I achieve this? Okay, I need a place for meditation, find a quiet place. Okay, I need the training in meditation maybe, or I can just watch YouTube.
Mhm.
Okay, realistic. Can I realistic achieve it? This is about motivation and obstacles. Okay, if you keep telling yourself, I got no time, then yeah, basically you can scrap the whole goal already because you keep saying you no time. Make time. Okay, yes, everyone is busy. I'm not saying that no one is not busy, but prioritize. If your goal is, your priority and your goal is to take 15 minutes off, then please do take that 15 minutes off for yourself. Okay, this is how you stay motivated. Okay, there always be obstacles. Okay, maybe you want to set it like every Thursday or every day after 4 p.m. But now you got things to do at 4 p.m. We can move the time. It doesn't have to be every day. Sharp 4 p.m. I have to meditate. No, you can do it any day as long as within that day.
Mhm.
Okay, timely. When do I exactly want to accomplish it? I want to reduce my stress in 3 months. I can commit 15 minutes a day, meditate 3 times a week. Okay, so this is how you can do it timely. This is something that, you know, it is something that commitment. So in reality, not many people are practicing, but there is still people practicing. Because when I do this, when I explain about goal setting, and like I shared just now, I come counseling, I really have to take care, I talk to you, and then I have to do so many homeworks. Yes, like I said, this is a lifestyle. We have to change because currently you are facing stress. This stress is not built up in 1 or 2 days. Okay, it definitely happened for quite some time. Like the video we saw just now, where the elderly person, after taking of 7 years, okay, he committed a crime where, you know, he assaulted the wife. Okay, so you can see that, you know, the person is already at the brink of tired. You know, they just want to end this. Okay, but at the same time, we also have to find coping skill and practice this based on when you are available, setting goals. Because our ultimate goal is to self-care, to reach self-care and reduce your stress. Okay. Another one is finding solution. Finding solution, there's a few steps. Okay. The one that I always recommend, I have 7 steps inside. Okay, you have to identify the problem. Okay, look at the situation with open mind. Open mind as in like where there's no bias. Like, try not to include bias. Okay, and we always look at the presenting problem. We always look at the current problem because it might not be the first thing that comes to your mind. Because when you see that thing with bias or related to your own opinion, then you see the thing that way. But try to not to see that in a way, but more openly. Then you can, then we want to focus on what is the presenting problem.
Mhm.
So like, for example, I'm tired most of the time. It might seem to be a presenting issue, but it can be due to your belief. Okay, no one is taking care of Charlie like I do. So I can be tired.
Mhm.
So the first thing you said, I'm tired, it might not be the presenting issue. Yes, it can be a characteristic of stress, but what is the main issue? Okay, that's where your belief can be that no one is better than me, no one is taking care of Charlie. Yes, I do. Okay. And then what's the problem? Thinking that only I am good enough to take care of Charlie, or I have to do everything for myself and Charlie. So this is the breakdown of identifying problem. Okay, this is, you can work with yourself, identify your own problem, or you can work with mental health professionals. Okay, normally they work around this, finding solution for your current problem. And you can list out all the possible solutions. Okay, try a different point of view. Okay, let's say you say that no one doing better than you, then why not different way of handling the situation? It can be just as good as, maybe it can be just as good as I do. Then if not, ask a friend for help. Because like I said, no one doing better than, do you ask people around you? Sometimes if you don't ask, the answer is always no. So when you ask around, ask a friend to help, talk to family members for help, talk to someone who has similar situation, like the one we seen in the video. The lady, she started sharing how she take care of the mother and how the mother used to take care for others. Okay, so this is where you share and you work with people who have the similar. These are part example of a possible solution for that problem that I had like just now. The problem I had just now is no one can take care of Charlie better than I do. So then I try to find out how do I address this? Okay, and then like just now, action plan. Choose the solution and try it, and then see the result. Does it work? If it doesn't work, we go back to list out the solution and try it again. Try another solution. Okay, if the first one worked, then pick another solution. Do not give up. Okay, so like I said, it's very important that you don't give up, because sometimes require time on tuning on idea. So it really based on yourself, how you can do it, how you cannot do it. And then that's why self-care and this strategy go hand in hand. Okay, because it will require a lot of trial and error. There's no exact one size fit all treatment. So it's all trial and error. So you have to stay not tired. You have to be not tired and stay in the best compose as possible. Like you're in the best state as possible. Not to be the best, but enough for that situation. Okay, and like I said, one of the factors for caregiver stress commonly found in Malaysia is lack of information. Okay, so you have to utilize resources around you. This is very important as well. If you don't ask, like I keep repeating myself today, if you don't ask, the answer forever is going to be a no. Okay, so gathering information, ask about other caregivers, post in the face. Nowadays, social media is very good. Put a hashtag caregiver, everything will come out. Okay, and then or you go, TikTok. If you think YouTube is too long, Facebook is too long, you can go for Instagram Reel. Just put the hashtag caregivers. Okay, or you go TikTok and put hashtag caregivers. There's tips, there's information about it. Okay, if you don't know about, like, let's say I don't know about cerebral palsy, I don't know about autism, something as simple as TikTok, only like what, 20-second reel, 20-second video, you put the hashtag autism and you can see, they will play 20 seconds. Okay, and you can just, some people who prefer reading, you can just go read about it, okay, on trusted website like Mayo Clinic. Okay, not Wikipedia is not trustworthy, but Wikipedia is an open website, so everyone can contribute their opinion. But you can go for like clinic website like Mayo Clinic, and there's other few, WebMD, they talk about diseases. Okay. Talk to a professional, friends, family members for suggestions. The more you talk, the more you approach your local resources around you, the more you gain. Okay, government facilities, private facilities, TikTok, social media, utilize whatever you can to help you. Okay, it's very important. The last step, 7th step, is starting seems to workable. Accept the problem that may not have solution at the moment, and then we will revisit revisit again. So this is the hardest, one of, I would say, when I work with caregivers or parents, this is one of the hardest part. Okay, accepting that at this moment, I've tried all I can, but everything doesn't seem to work. Okay, so this is sometimes I tell parents, at this moment, this is the only things that you can do. So we have to accept it first. Okay, this is very hard for most, even this is very hard for most of us to accept. Not defeat. Okay, we are not defeated. It has nothing to do with defeat. It's not a competition. It's just that we will revisit this problem again. Because at this moment, this is only, I'm capable of doing so much only. Okay, maybe down the road, 2 to 3 days time or a week time, I will revisit this problem again. Okay, and then caregivers tend to jump from, step 1 to 7. They're most likely to experience difficulty and feel defeated. Like I said, it's not a competition in the first place. Why do you feel defeated? Maybe you feel dejected. Yeah, okay, feel dejected or sad. Yes, but don't see it as a competition. Okay, and then you are likely to engage in finding solution. Okay, so there's this 7 step. Yeah, sometimes they do skip. A lot of people skip. Even when I first try it out, also, I might skip some of the few steps, but it's very important to go through step by step. Okay, it's okay to revisit each of the problem. Okay, because problem will always be there, but it's just that we have to make it in a way that we can manage. When we cannot manage, then it will overflow.
So like,
yes,
so many different things today, and like managing stress and how we can do it. And then earlier we spoke about also communication. So can you tell, like, why is it important for us to practice communication among caregivers?
Okay, so communication, it's very important to share about your feelings. So we talked about just now the 7 steps: identifying problem, the strategies, finding solution, self-care. A part of it is communication. Why communication? Because we communicate a lot. Okay, and then a lot of things that there's a difference. Okay, you have to take responsibility on how you feel. Okay, so one of the things that when we communicate, it's better to use clear, constructive, and assertive. Okay, straight to the point. Don't go around and beating the bush. You know now what I want. You know what? You know. Sorry, I don't know. Okay? I don't know. And then use I statement. Okay, this is the things that I see a lot. Like people start. You make me feel sad. I feel good because I blame it on you. I don't take the full responsibility of my emotion. You're allowed to you express your feelings without blaming others or making them become defensive. Okay, so communication is, if you are able to communicate, is our mode of knowing each other. That's why it's very important. I statement, yes, it's very important. You have to take responsibility of how you feel, and then you have to respect boundaries and feeling. Okay, if a person don't feel like sharing it, don't push them. Like, hey, tell me lah, tell me. They tell me what. So, people's like, yeah, I'm not in the good mood to talk. Then yeah, just leave it be. And then avoid brushing off a person right to state how they feel. Like, for example, Alisa, my fish just died. It's okay lah, don't be a crybaby. Fish only one like that. So it's not good to brush off when someone they say something about how they feel. It's okay that you keep quiet. Again, you can even say, I'm so sorry, I don't know what to do because I cannot relate to your experience.
But don't belittle their feelings.
Correct, and you don't brush them or like toughen up. You are a boy, what? Boy cannot cry. So these are the things that, okay, in Asian community, we hardly talk about feelings. Okay, so when we communicate, it's very, people like to, because it's in, we grow up like this, and that's how we speak. But emotion carries, then communication is very important. So that we can communicate clear and specific. Okay, speak directly, don't hint something. Like, lah what I want, I don't know. Can you be specific on what you want? Okay, what you need. Okay, try to send the message short and precise. Okay, don't go around and guessing and whatnot. Because I already having stress, you having stress. We beat around the bush, and then I will become defensive. You will become defensive.
I think maybe because this one could be also because like I think a lot of people, this is just an assumption. Maybe it's because like people have this mindset where, okay, if it's so simple to me, why is it that the other person don't really understand?
Yeah, it's so simple to you, but
Yeah.
you still have to send the message out. Okay, so what is simple? Okay, this is where perception comes in. You perceive that is simple to you, but it might not be perceived as simple. It's like when people say sometimes it's general knowledge. What you don't know, man. Okay, what is general to you might not be general to me. So I don't know. It's like okay, I give you an example. Alisa, what do you do this Sunday?
I'm supposed to say something, is it?
Yeah.
I'm going to cook later.
Then, never mind lah. I want to tell you something, but it's okay lah. You want to cook? You're gonna cook, is it? Okay lah, it's okay lah. You see?
So it's like getting people like eager to know, and then you just
So if you try to make it clear and simple, Alisa, what are you gonna do after this?
I'm going to cook.
Okay. Oh, okay. I might need your help, but are you available? Or are you gonna cook straight away? I need your help in taking care of Charlie. So clear and simple. It's not like yeah, never mind. But yeah, it's okay lah. You have to.
Don't wanna ask for that.
Yes. So sometimes, so it's like, lah. I don't know. You want something, you tell. So the communication, it becomes quite complicated because we rely on communication to exchange information verbally. So it's very important. Okay, another one is listening versus hearing. You can hear a person, but you may not be able to listen in order to understand them. So here is like, okay, I hear you, but does that mean the person listen to you? It might not be that way. It's like you're going to a lecture in the class, 2 hours, the person talk, okay, you hear them, but how much do you listen?
Understand from it.
Correct. The more you listen, the more you understand, but it's not as easy. That's why there's only our attention of listening is not long. Different people, different. So when you drag in the conversation, I wanna, so the person is like, by the time they finish listening, you still haven't get to the point they already changed to hearing. So, so it's very different. Okay, so we talk about communication, and then we talk about finding solution, the 7 steps, setting goals. Okay, finding solution, the 7 steps. Okay, identifying issue, self-care. So far, any other questions? Any questions?
For now, no. Even the live doesn't have any questions yet.
Okay, no problem. So for those who have any questions, you can just pause it. Even those who didn't get to watch this, you can rewatch this. It will be on our Facebook page. Okay, then I move on to the last bit, second last. From just now we talked about communication. So communication, we rely verbally on exchange information. That's where we can relate to requesting for help. Okay, if you don't communicate, how are you going to request for help? Okay, one of the major ways for communication. Okay, so like you said just now in the beginning of this session, where some of them, they feel like, I don't want to burden, I feel guilty. Okay, and then some of them, they try to impress others in a way that they can handle everything themselves. Okay, but help can come from different sources. Okay, from professional, from your community, from your social group, from family and friends. Reaching out for help is a sign of personal strength. Okay, it's not weakness. Showing your weaknesses is also a strength. Okay, we grow up saying that you cannot show, you cannot cry, a male cannot cry, this kind of thing. If you're able to do something, bring out yourself, that's a strength. Okay, it does not make you look weak. Okay, a person cry doesn't mean that it's weak, because we learn this at school, even in kindergarten. Crying face, sad face. So, you know, it's okay to cry, meaning that you are sad. So why certain gender are not allowed to cry? So this is where it become a miscommunication or misunderstanding. Okay, you're supposed to look macho because you are a certain type of gender. So yeah, so this is miscommunication or misunderstanding.
Yeah.
Okay, and then talking about your difficulty, maybe in public you're worried, it's okay. Find someone you can talk to, but that doesn't mean that you look weak. Okay, yeah. I mean, it's like, have you seen National Geographic? You know, when they talk about animal kingdom, okay, you know, animal like lions, you know, when they show weaknesses, okay, people, you know, other lion will attack them. Okay, that's animal, basically. But that doesn't mean that, you know, they can hide. But in human, we are more complex than animal. Animal quite straightforward. So that doesn't mean that, you know, you're weak just by talking about what you cannot do. Okay, it's just like I said, lion, animal kingdom. When someone is weak in the animal kingdom, the lion, they will protect. Okay, showing that it's weak. One individual in that pack of lion, if they are weak, that doesn't mean the whole pack is weak. So that's why they rely on the family members. Okay, simple as that. Okay, you only the enemy will attack, not your own people. Okay, when you talk to your own people, things about you cannot do. It's not about like how weak you are. It's about like the strength of bringing up. It's not easy to talk about something that you cannot do or not comfortable with. Especially when someone talk about the ego, I don't want to talk about this, I don't know. But sometimes just to share it out with people. Okay, and then when come to requesting for help, like I said, the communication we talk about, be simple, be straightforward, don't hide around, okay, and then don't harp on something. Alisa, I know you're cooking already, right, after this, but after that I come again. Alisa, can you help me? Seeing that you're going to cook, Alisa, I keep coming and ask you. So eventually the person will get tired out. So avoid asking the person repeatedly, okay, if you can. And then timing, okay, timing, when the timing is not good, then you ask, then, you know, the answer, I mean, there's a right time or right thing of asking, okay? It's not like, you know, it's not like I'm going to ask you a question while you're cooking. Before you cook, I ask. Maybe that's the right timing. Or the best part is you can ask the person, Alisa, you're going to cook what time? Once I need to talk to you for a while. What's the best timing? What do you think is the best timing to talk before you cook? So straightforward. This communication is very important. And then you can be ready for rejection. Okay, because asking, you have 50% of yes or no. So be prepared.
This also makes people feel like, oh, if I have to be prepared for rejection, then why should I ask for help?
Because you know why? If you're not prepared, you start scolding the person because you get upset. Then you start bringing out the past. Last time I helped you, what, Alisa? Why now you cannot help me? Now you're going to cook only, ma. Well, last time I was so busy there, I have to U-turn and buy the bubble tea for you. Something like that, you know. So if you're not ready for rejection, you will be, not all the time, but defensive in a way. Oh, like that lah. Last time I helped you, now you don't want lah. So when you are prepared, you are more like exam. You know, you prepared for the exam, you are more calm. Yeah, you do feel upset. Yes, I'm not saying that if you're prepared, you're not. But it's just that you are able to handle the situation better when you're prepared. Okay, yeah. You say no, and then, oh, it's okay lah. Thank you, like that. Then you leave. Yeah. So, you know, there's a way of asking help. So, and then be assertive, be polite. Like for example, this is like just now I ask, you gonna cook? Then it's okay lah. Never mind lah. I can do it if you cannot. So you know, this conversation is very like it's not clear and specific.
Yeah.
So it's just as simple as, Can you do it or not? So
Yeah.
you're cooking, then it's okay, never mind. I find someone else, okay? And then talk to a doctor, communicate, ask for help, talk to a doctor. If you don't know what to ask, what I always tell parents is look for FAQ, frequently asked questions with doctors, okay? This is where you can see all sort of question that is frequently asked, what to ask, where to ask, or talk to someone who have seen this doctor before. Get the experience from them, okay? And then from there, when doctor says something, it's okay to ask them. Like, what is this? I don't understand. Can you explain more? Like, for example, your child need OT. Parents who don't know OT, you can ask, what is OT? What do OT do? What is that? I never heard of it. It's okay to ask. Okay. So one of the ways is to check the FAQ, frequently asked question in Google. Just type psychiatrist FAQ, or frequently asked question psychiatrist. Or nowadays, very advanced, like I said, you got TikTok, #psychiatrist. They will show a lot of video about psychiatrists. In 20 seconds, you can just watch the reel and scroll. Okay, that's where you get information. Okay. And then also, there's other things you can do in terms of communication is understanding your emotion. Okay, understanding your emotion can be very important. It is a strength if you can control your emotion. So this is part of strategy. Okay, we talk about a lot about strategy, but before we end today, this is something that is a take-home message for everyone. Understanding your emotion is very, very important. Okay,
So
yes.
when you say controlling your emotion, it doesn't mean bottling it up, right?
Okay, before you control, we talk about understanding first. How can you control something when you don't understand? So like, how can you provide care when you don't understand? So one of the strategies that I work with parents is to understand your emotion. Okay, this is the reason why I put it at the last bit, because it's not easy when you talk about emotion, because like I said, we grow up different culture. Some culture, they emphasize on emotions, some don't. Okay, so for those who don't, if you grow up in a culture where don't emphasize emotion, it's very hard for us to identify. You know, in school, primary school or secondary school or even kindergarten, they talk about basic feeling, complex feelings with children. Okay, so but then it's not applicable outside. Okay, like I said just now, the situation where crying picture, meaning the person is sad, but when go out in reality, you cannot cry. Cry is for people who are weak. So it doesn't make sense. So that's where the emotion and the act of crying is distorted. But I learned in school, cry means sad or upset with something. Why? So yeah. So that's why sometimes you can see in a culture that who don't emphasize on emotion, they will try guessing about the crying. They cry because they're hungry. And they cry because of angry. They cry because upset. So yeah.
You won't really know.
Yeah. So sometimes, like I said, adult, suddenly you see someone crying on the roadside. So you get a lot of things in your head. The person kena rob lah. The person maybe fall down lah. See, you don't jump straight to your emotion.
Yeah.
So not supposedly, ideally, okay, when you see someone crying, it's like, oh, is she upset? So this is how you relate to your emotion, because we are not practicing this in real life. So when we first see someone get upset, we think about what happened instead of like,
possibilities.
Yeah. So you can see different culture, like for example, in the Western. So when they see the child or anyone crying, they will say, oh, they will like, are you feeling sad? Why are you crying? For the Asian part, it's like, what happened? Someone steal your car. So yeah, it's okay. So because it's not something that we practice, but when we talk about stress, it's very important because then it will help you to identify. If I feel sad, oh, actually this is a feeling of feel sad, or this is sad and how my facial is like. If not, why would you learn smiley face is happy?
Yeah.
So this is help us to identify based on the facial and our feeling, what are the characteristics. When you feel anxious, your heart palpitate, pop, 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 like that. So this is help you to identify your emotion. And then once you identify, then you move to understanding your emotion. It's very important. Okay, it's a strength. If you're able to recognize when your emotion is controlling you, not you are controlling your emotion. See? So once you identify, you understand how emotion happens in you, then you know whether your emotion is controlling you or you are controlling the information, your emotion. Like you said just now, controlling is like you say something that maybe it's mean when you are feeling certain emotion. That's where you know that the emotion is controlling you. That's why you have to identify first, identify your emotion, and then what you can do and what you cannot do. Okay, be it a positive or negative event. So regardless, positive or negative event, your feeling is an decision too. It's very important for you to understand what is happening. You can learn from your emotion and take action. Okay. So for example, one of the example, emotional pain because of discomfort. Okay. You override all the pleasure. It might be a sign of increased stress. Okay, changing caregiver system. Okay, so this is one of the things as a caregiver. If you feel like you no longer enjoy something you enjoy, this is where you know that your emotion is taking over. Okay, so with the step or strategies that we shared just now, once you identify, then we have to find a way how to cope with it. Okay, sometimes people like comfort eating. You know, when they feel sad, they eat ice cream, comfort eating. Do what is best because we all learn how to cope. It's just that we didn't put it in practice. We hardly talk about it. Okay, so we have to identify. Different people have different way of coping. Okay, and so that's why today our topic about managing. Okay, we go through a lot from what is caregiver stress. Who are the caregivers? I mean, who are caregivers? What are caregivers? You know, what are the stress? How that's an effect and strategies. So yeah. So today I've shared a lot, and hopefully those who join us are able to. I mean, you can scroll back now. This is just in general about caregiver stress. Actually, it's more specific, but because today it's only a 2 hours talk. And also so far this is what I can share. If you would like to know more, feel free to post in the comment box.
So it's also very much more about the individuals. They have to like take that first step into seeking for help or to help themselves first, like you said earlier. I think that's something that is the most important thing from today, is like always take that first step to care about yourself before caring for others, because a lot of things contribute to it.
Correct. So like what I shared just now, self-care is number one when we talk about caregivers. Okay. If we don't talk about caregivers also in a daily basis, self-care is also important. Okay, like hygiene. You wake up, brush your teeth. Why you take care of your teeth and gum? But now we put it in more specific settings where we talk about caregivers. And then, like you said, identifying your problem. What is stopping you from achieving self-care? Okay, what are the things to reduce stresses? How do I manage stress? How do I manage my emotions? All of these things. Communication, seek help. Okay, ways to seek help. We also talk about it. Yeah.
So these will all like reduce the possibilities of the thinking so much about how people will react when you bring your kid out and all of that are basic. Because I think we shouldn't really stop parents from bringing, or like everyone, you can, like you said we cannot control other people. So everybody is going to keep saying a lot of things. Everybody is going to say things that is going to affect you. But how you react to the situation, I think, is very important, because can you go and like coop your child up for so long and then your child don't get to explore and learn things because of what you are afraid people might say. So I think limiting should not be like an option anymore.
Yeah, there's different ways. I've seen parents have very, very unique way to cope with the situation. Some even bring flyers. So when they see they see the other parents react differently, they just take out the flyers. Hi, this is my child having this disease. You might want to read about this. Thank you. If you have any question, I'm staying here, this neighborhood, you can ask me. So some parents do that. And then some I can see that when they go for a gym, they give a small gift for everyone. Why? Because they know their child have behavior issue, might disrupt others. As simple as that.
This is
So
all
this-
like to raise awareness kind of thing.
not only that, but it's also the way for the parents to cope with whatever people say. This is how they cope. Okay, they know that the child in this situation, so they apologize first. That doesn't mean they are weak. Okay, so they are taking responsibility. They let you know first. Yeah, it's like if you stay in a condo or a flat or apartment, people will give you notice before they renovate the house next door, right? Cannot be they go and drill and then they didn't give you notice, then do some major renovation. So that's the same thing. Because it can be, yes, hurtful when as a caregivers, especially now in particular, parents with children with disability, the moment you go out, your child doesn't fit into the social norm, then yes, a lot of difficulties, especially words, like I said, communications. We rely a lot on talking. So when, Lisa, why you like that one so weird? Of course, you feel upset. Right? I'm not a robot. Yeah. So when I feel upset, I can control how. Okay. So when you feel upset, your emotion take over, then you go punch the person up. So there's a lot of way of doing it. Yeah.
So there's a lot of things that shared today. I think I learned also a lot of things, even though I'm not a caregiver. I think about the whole stress thing and understanding from a caregiver's point of view also is very important, because outsiders, they think that, okay lah, the child is making noise, it's going to affect me, it's making me stressed. But they don't really think about it like the parents are there with them 24/7. How does the parents feel if I pass remarks? So it's all like you need to take in consideration each other's feelings also.
Yeah, that's right. You cannot control people's mouth, but you can control how you. It's not like suppressing. We don't want to suppress the emotion. We are human. Definitely, we'll feel upset when people say something. We will feel defensive. But how do we channel it to a safer way?
Yeah.
I can do a lot of way like taking drugs and whatnot, but it's just momentarily. Okay, that's why people get addicted into substances. Yeah, because you get hooked into it. How long you're gonna do it? Then it will be another. That will be another issue. I'm just giving an example. Yeah.
It's
So
like
So especially.
process.
Yeah, that's why it's a long. It's a lifestyle. It's a pattern. It's a long pattern that we need to break the cycle, or else it will be never ending. Yeah. Especially now after COVID, this is the time where we all can reach out.
Okay, so is there anything else you would like to share?
No, that's it for me.
Okay, so
Thank you,
far there's
Nathan.
no comment, and yeah. So
Yeah.
thank you so much for sharing with us about managing stress today, Ms. Charlie. So yeah,
No
I'll end
problem.
now.
No problem, because as a mental health professional, this is what I do: advocate and sharing information as much as possible, especially related to mental health. Okay, mental health is complicated and it's a stigma, but we, as a mental health professional, I want to break this stigma and raise awareness among the community, because the earlier we detect, the better that we can identify, because mental health is not something like physical health. It's slightly complicated. Like, if I take the temperature, show my head thin, I got fever. But mental health require more than that, and a lot of trial and error. So that's why we have to share as much as possible, and early detection is very important. But also, if you detect it quite sometime later in the age, it's okay. Parents, don't blame yourself, because we wouldn't know. We don't
Yes.
know much about mental health. So some people say that detect earlier, you miss the golden time. Okay, I agree and disagree lah. Because some of the child only later I notice. So what is the golden time? Golden time 5 years old or 10 years old? Okay, so I agree and disagree to that statement because some will develop later, some disability develop later or detect slightly later. Okay, then does that mean I missed the golden opportunity? So that's where it becomes a question. Okay, so whatever happens, we focus on what we can do and support the child's development. And also, please, to all the caregivers out there, informal or formal, please do take care of yourself. Like I said, I repeated many times, self-care is very important. And thank you for everyone attending today, and thank you for hosting this, Lisa. That hosting this allowed me to share my experience and some information about caregiver stress.
Okay. Thank you so much, Ms. Charlie. I'll see you again.
All right. Okay. Bye-bye.
Bye.